Welcome to Innovators, a series where we sit down with thought leaders in the healthcare technology space to talk about the news and trends that are impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Christie Teigland, our VP of Research Science and Advanced Analytics, who has actually joined us on our Innovators podcast previously. This episode is part of our mini-series where we're going to look specifically at 2025 and what our internal thought leaders predict will be top of mind in the healthcare technology space. Today, Christie and I are going to discuss research and health equity. Thanks for being here today, Christie.
Thank you. I'm always happy to talk about health equity. Justine, happy to be here.
I know you are. So there has a lot of your research has uncovered alarming disparities across healthcare in asthma, breast cancer, bipolar disorder, liver cancer. What do you think that healthcare leaders have to do for the industry to see more of a significant shift in health equity?
All of my colleagues have memorized what I like to start these conversations with, always to set the stage, and that is the fact that only 20% of our health outcomes are actually driven by the clinical care that we get. And 80% of our health outcomes are driven by health behaviors, social and economic factors, things like income and education, access to transportation, do you live alone? All of these factors are really important to driving our health outcomes. So the point of this, Justine, is that while I think we all believe that addressing health disparities is the right thing to do, there's now substantial evidence that it really impacts the bottom line, that there's a return on investment for addressing social disparities. And I think that's going to really drive the difference. But what healthcare leaders, getting to your question, really need to understand is what are those drivers of health, those social drivers of health that are really impacting health outcomes, that are really causing those health disparities that we're still seeing. And the first barrier that is still a barrier to understanding how to get at these health disparities is access to data, right? We just don't have good data on what our members, our health plan members, patients, what are your social drivers of health? We don't have good access to data on race and ethnicity, on income levels and education levels. And so one of the things that you know that I'm passionate about is that we have built a very large social drivers of health data warehouse at Inovalon over the past decade or so. I'm really proud of this data warehouse because we have now used it to link actual data on patients' social drivers of health to their clinical data so that we can understand how they are impacting their health outcomes, how they are causing disparities. And so we have published now multiple peer-reviewed manuscripts that have really dove into this issue, and we have found disparities related to, say in severe mental illness. English language proficiency is driving access to good care for people with severe mental illness. Income levels really can impact how likely it is that you will end up in the hospital or end up in the ER. So access to data on social drivers of health is really important. I think the second barrier is really access to connect patients to the right resources to address those social risk factors once you know what they are. So as you know, individual physicians, individual plans can't always address every social risk factor. They can't provide housing, all of it, right? They can't provide food, access to food, or in many cases, access to transportation, or those things that are leading to those health disparities. So what we need is a better infrastructure to link patients to the community resources that they need, access to housing, access to food. Those resources might be available out there in the community, but the infrastructure to find them and connect patients to those resources just is really lacking. And so if once we are able to really build that infrastructure, I think we will go further to address health disparities. I think sometimes physicians and providers are even afraid to ask these questions because they don't feel like they can do anything about it. They don't have the resources to do anything about it.
So there are some barriers, some challenges, but tell me a little bit about the ways that we've started to see progress where it relates to health equity.
We have seen some progress, and I'm proud to have been part of some of the research that's driven some of that progress. One example is some research that we did with Humana, which, as you know, is a really big health plan, and they've already used this data where we sort of looked at their Medicare Advantage plans and developed ways to measure where the biggest disparities were. And one of the examples that they wrote about in the New England Journal of Medicine, an article that we published, was related to, they found a big disparity in patients who lived in Florida, who identified as Black Americans, and in their adherence to their hypertension medications. And what they found was, digging deeper, was that those members had not seen their primary care provider in over a year. And so what they were able to do was actually link up with some community resources, some community social services, social outreach agencies to do outreach to those members to help them to understand you got to get in to see your PCP. Taking your medications is really important, because if you don't, these are the bad things that are going to happen. You're going to end up in the hospital. You're going to end up with poor health outcomes. And so that has really made a difference, and it was all driven by these measures that we put together with Humanity to really find where those big disparities actually were. There have also been some policy initiatives, some really important policy initiatives. One example is that the CMS announced that they're going to incorporate a health equity index measure into the Medicare Advantage 5-star rating system. And what this health equity index measure will actually do is help health plans, really incentivize health plans to do better with their disadvantaged members. And so it'll actually be part of their reward factor, which is actually payment, right? It's worth bonus payments, worth millions to billions of dollars to some of these big health plans. So it's really putting some skin in the game, right? Some real dollars attached. So that means these plans will have incentive to actually invest more resources to address their biggest disparities, and that, we hope, will really make a difference. Another example I'll just quickly mention is the Inflation Reduction Act. And one of the things that the 2023 Inflation Reduction Act did was reduce the price of drugs, reduce the cost of drugs. And so one example is the $35 cap on out-of-pocket costs for insulin. And this is really expected to bring big relief to senior citizens, to low-income, members who maybe can't afford their diabetes medication. And we all know that if you don't take your diabetes medication, you're going to have poor outcomes, right? And that's going to be much more costly, not only to the health plans, to the payers, but also to the patient, right? And so we're actually working on a study right now with the Pharmacy Quality Alliance, who actually has developed some measures around persistence to insulin, to treatment for diabetes, and to see what is the impact of this $35 cap on the price of insulin, on the out-of-pocket costs that people have to pay to get their insulin. Is it making a difference, right? Is it improving adherence to your medication? So those are some really important, policy initiatives. Sadly, there was a 2024 report from the National Academies of Medicine that said there really has been very little progress in closing racial and ethnic disparities in U.S. healthcare. And there are these deep structural disparities, inequities that really have to be addressed. So we still have a long ways to go.
All right, well, looking into 2025, hopefully this will be a positive prediction, but tell me, what is your number one prediction, and do you think that the next step to, like we're talking about, outcomes and care is the next step improving that care access for all people?
I guess I have to talk about artificial intelligence. Everybody's talking about artificial intelligence and AI, and I think 2025 is going to be the year where we really see more applications of artificial intelligence in healthcare. The progress has been a little slow because, let's face it, it's really sensitive, right? We're dealing with really sensitive data, and then the potential impact on patients is real, right? We're impacting people's lives. So while we have to be cautious, I'm still really optimistic that there are applications of artificial intelligence in healthcare that will really move us forward. One example is artificial intelligence can interpret all of this unstructured data that sits in these clinical notes that we really have largely not been able to tap, right? Because we can't, it's not in data fields and we can't analyze it really easily. AI can really help us do that, and so it can really help with clinical decision-making, better outcomes. The other thing that I have to talk about is using not only artificial intelligence, but just the advanced analytics that teams like my team at Inovalon use to really help uncover these really complex, sometimes, interrelationships between social risk factors. And I'll give you an example of that. We did a study with a large life science company, and we found something really interesting. We found that if you look at low-income Black Americans and you compare them to low-income white Americans, and these are people with liver cancer, and you look at access to treatment and early surveillance and diagnosis of liver cancer, low income, whether you're Black or white, you have pretty poor access to early diagnosis, which is really important to having good outcomes in liver cancer. What we did find, though, was that at higher income levels, Blacks actually have much lower access to early surveillance, early diagnosis of treatment for liver cancer, and of being able to get at that early enough so that you literally can be treated and don't die from liver cancer. This actually has a name. It's been called diminishing returns, and so this really speaks to the structural barriers that are there. And so my point is, if you had just looked at rates of surveillance, rates of diagnoses by income alone or by race alone, you wouldn't have found this disparity, right? But when we looked at the combination of income and race, we found this big disparity. So that's just an example of how sometimes these risk factors are really subtle, the relationships are complex, and you have to dig a little bit deeper. And that's what, teams like my team that has advanced analytics and access to some of these artificial intelligence tools, machine learning tools, can really help plans to get at. So it's not something that just anyone can crunch the data and find, right?
Absolutely. And I mean, that leads me perfectly into my next question. You and your team are regularly in healthcare data. You're comfortable navigating this data. So with the experience that you have, what advice do you have for healthcare organizations who are looking to expand their data sets or their analytics capabilities?
I think the first and most important thing is that plans adopt a really holistic data strategy that really can address the integration of their data sets, as well as a lot of data literacy challenges that we have, meaning people don't understand what the data means or how to use it. We don't suffer from a lack of data. We don't need more data in healthcare, but we need better access, and we need to understand better how to use it. And I think, so just building on that, I think the second thing that healthcare organizations need to do is really form partnerships, not to be self-serving, but partnerships with technology companies like Inovalon, because we can really help them address, some of the how to use these complex data sets and how to crunch the data. I really think that, in many cases, it's really more efficient and more cost effective for organizations to use organizations like Inovalon and teams like mine that have the clinical expertise, the technical, the analytic expertise. I've known some organizations that try to build that on their own, and it's really, they find out that it's not very realistic or cost effective. We do this every day. We've got the tools, we've got the cloud-based computing, we have access to real-time data, we have access to the analytics and all of those technology tools. So building those partnerships, having a holistic strategy so you can pull all of that disparate data together so that it can make sense and that you're not missing this piece of information or that piece of information is really how we're going to solve some of these health disparities that seem to be really difficult to get at.
Absolutely. Well, Christie, every time we talk, I walk away having learned something new. So really, it will be interesting to see what is to come in 2025. But thank you so much for sitting down with me today and for sharing this insight.
I always love talking about this. This is my passion and why I come to work every day. So I'm happy to be here and share some of what we're doing.
Yes, absolutely. And to our audience, thank you for tuning in. Be sure to check out our other episodes of our Trends and Predictions mini-series.